Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Breath holding spells. Breath holding spells are rare before 6 months of age, and these breath holding spells will peak at around 2 years and they subside by 5 years of age. The child holds the breath in full expiration. So in breath holding spells there will be they are actually cyanotic spells which are precipitated by anger and frustration. These are pallid spells which are precipitated by fear. Iron supplementation may be useful in some children with breath holding spells.
So with breath holding spells, they are of two types. We have pallid type and cyanotic. In cyanotic, the breath holding spells are mainly precipitated by anger, whereas in pallid spells, the breath holding spells are precipitated by the fear in the baby.
thank you and thank you for watching.